The president suggesting repeal now, replace later. Is that your official stance now? Is that an acknowledgement that the Senate bill is essentially unworkable as it stands?
No, we don't think so. We think that Leader McConnell and his senators within the Senate are working to try to get this piece of legislation on track. Their conversations are ongoing as we speak, and so we look forward to hopefully them coming back after this 4th of July recess and getting the work done.
If the replacement part is too difficult for Republicans to come together, then let's go back and take care of the first step in repeal. And then at that point, if you've repealed it, you can come back with a replacement effort that could be more bipartisan.
If we can do a combined repeal and replace over the next week, that's great. If we can't, though, then there's no reason to walk away. We should do repeal with a delay. Let's be clear, I don't want to see anybody thrown off the coverage they have now, but I think we should get straight to work at around-the-clock hearings on the replace plan.
I want repeal to work, and the way you do is you separate it into 2 bills and you do it concurrently. Right now, you're right. Senate leadership's not doing that. Senate leadership is loading the bill like a Christmas tree with billion-dollar ornaments, baubles, you name it.
If we adopted a measure, if we passed a measure repealing Obamacare and put a delayed implementation measure in there, with the understanding that at that point, after passing the repeal measure, we would undertake the step-by-step process of deciding what comes next, I think it's easier. Sometimes when you lump too many things into one piece of legislation, you doom its likelihood of success.
President Trump did tweet that if Republican senators are unable to pass a health care bill, they should immediately repeal Obamacare and then replace it at a later date. Do you support that approach?
I don't know what that means. Honestly, I don't think the president really, I don't really know.
Repeal, then replace?
No, what I'm saying to you is I don't know that he, look, if somebody were to go to him and say, look, we could sit down with the Democrats and we could come up with a deal that would improve the system, you call it one thing and they can call it another thing, I think he'd be fine with it. He's a negotiator.
This Congressional Budget Office indicated that if you simply repeal the Affordable Care Act, Obamacare, you will throw 32 million Americans off of health insurance, 10% of the population of the United States.
They can't get 50 votes to repeal it because somebody's getting hurt more than what they're willing to sign on to. Then look at some of us, work with us Democrats who are willing to meet you in the middle.